Can you die from a bug bite? Absolutely, yes. So that's what we're going to talk about today. And hopefully, after today's lesson, this talk, you'll be able to arm yourself with the things to prepare to avoid those life threatening injuries and illnesses. And without further ado, let's jump into it. Hey everyone, my name is Dr. Tan, your survival doctor, and today we are talking about bug bites. And for those of you who are new to this channel, we talk about the medical side of survival and preparedness. So if that's something that interests you, whether you're a camper, hiker, or anything in between, that you just want to make sure that your kids, your family's all right, and you don't end up going to the ER for any kind of reason, this channel is for you. So if that's interesting, click subscribe. And we are also doing classes. So a lot of our students are behind the scenes right now, getting that special attention. And thank you for all those new students who onboarded with us this week. You guys, I am so excited for your questions. But before we even get to that, just know that you have a private chat. All of you viewers have a private chat, and I'll be answering questions in real time. So let me know, out of all of you, who's gotten bug bites up until this point, because I was just working outside. I got a few bug bites over here, some mosquito bites. I'm up in Maine, and it is tick country up here, and specifically Lyme disease country. So we're going to talk about a lot of the things that can kill you. And really, it comes back to my time in the military, because when we think about when I was exposed to a lot of things with not the most information at hand. I joined when I was 17 in the Canadian Armed Forces in the Army Infantry Division, and we would go out into the middle of the woods, do our basic training, our soldier training, and our infantry training, and be out there for weeks, if not months at a time. And oftentimes we'd get bit by a bunch of things. So ticks were an option. We were out training with a base in Virginia, which was such a cool exercise because we were working with artillery and all sorts of other people. And with that, in Virginia, there's brown recluse spiders that causes necrotic bites. Your tissue decays away. They also have black widows. So you were literally in a firing position, taking a knee, and you're being very quiet, very still, and you just see this little black widow go on your arm, and you have to like brush it off. So it's so important to know how to identify these bugs, how to know the telltale signs once you got bit, because some of them, it's you get infections, but some of them are really systemic problems that have long-term, sometimes irreversible effects. So we're going to be talking about ticks specifically. And for those of our students over here, or those viewers, let me know if there's other bugs that you're interested in talking about. But I want to prepare and preface all the campers and hikers, because we are in full-blown spring here in North America, and there's a lot of different bugs out there. So we'll focus on ticks, but also the things that you're likely to get as well, like mosquito bites, black flies, gnats, sunflies, and so forth. So in the military, we definitely had a lot of issues with that. But I think one of the worst, grossest, nerve chilling things that I've felt is pulling a tick off of my own neck. So I was driving, and I was just remembering, like, it didn't even hurt. I was just touching my hair just along that hairline, and that's typically where they like to go, in addition to some of the sensitive areas. And I thought I had a new mole. I thought I had like a skin tag or anything like that, and it just got bigger and bigger and bigger. And I remember driving and pulling it out, and then seeing it engorged super, super big, and just like flicking it out the window. And at that time, I had a big furry dog, and he oftentimes got ticks. So I probably got it out on an adventure with him. But there are different diseases out there that can be transmitted from different types of ticks, different types of insects. So today you are going to learn a framework on how to approach these types of issues. Does that sound good? Does that sound cool? Is that useful to you guys? Let me know in the comments. Just say yes. And yeah, let me know where you're coming from, because one of the first things that I want you to note is just Google your area, ticks or Lyme disease, and see if you're in one of those concerning areas, because as the climate gets warmer, the ticks are moving more and more north. So you'll see up in Canada, where I'm from, we're getting more ticks with Lyme disease carrying up there. So the framework that I'm talking about, it kind of follows that real world experience of getting these things on me to camping on my own, doing a lot of this bushcraft stuff, survival training, and then becoming a physician, and then training in wilderness medicine, and then finally having that practical experience of doing something like alone, where you are alone. You don't have a doctor that's going to give you antibiotics out there. So there's key things. Even if that tick is carrying Lyme disease, there's key things that you can do with very little effort, very little outside input that would prevent you from having Lyme disease. So that framework is all about awareness of the dangers and risks, identifications of the culprits, prevention, identifying consequences or signs that you may be infected or altered in a certain way, and then early treatment. So we'll talk about all of that. And if you think that you're not able to do this, I teach my students this all the time, and we are literally taking care of ourselves in the woods, especially for those who get to the level where they're coming on expeditions with me, where we're not necessarily learning new things, but practicing and figuring out the nuances of things. We're doing one training with Jesse Krebs, who's a SEER instructor and a fellow Alone Season 9 contestant. We're going up into the Denver, Colorado, the home of perhaps some Rocky Mountain spotted fever ticks. And we're doing cold weather survival and cold weather injuries up there in February. So that's interesting to you. Let me know in the comments. Say cold weather, and then I'll get you some of those details because the spots are pretty darn limited. But our students can do it. You can do it. And there's a lot of things to think about, because if you delay help, you can end up with some life threatening and permanent damage. So even if we have all these things going on, one of the things that we want to be aware of is general locations. We talked about Googling tick-borne illnesses in certain locations. Maine, New England, that's like a huge hub. And so the best thing that you can do is your locations and tick-borne illnesses, and you'll get an idea of what type of diseases are there. But a lot of the approach to it is pretty darn similar. So things that you might be aware of beyond ticks, also mosquitoes, is you can get like skin reactions. So one of the first things that I'm getting right now, I was just planting some blueberries, is a local skin reaction. So as we're thinking about awareness, mosquitoes, I'm not really in a place that has malaria, yellow fever, all these other things. But in North America, there is a decent amount of people, especially kids, who can be pretty allergic or have reactions to mosquito bites, horse flies, black flies, and they get these huge, huge welts. And what they typically are starts as redness, can be a little blanchy and blotty. And if you push your finger on it, it will turn white. And then as soon as you take that finger off, it will kind of return to color, so blanchable and pretty itchy. And you'll notice that that can come outside of where that bite area is. So it can start on your arm and then have this blotchy allergic reaction. So similar to other allergic reactions, and one of the reasons why I carry these 2 or 3 things that are super useful in your first aid kit is number one, I think to treat allergies, I like cetirizine or Claritin. It's a non-drowsy antihistamine, so an allergy medicine. And you can take 10 milligrams daily, and you can even double that up if need be. And that's pretty helpful. Just make sure that you're doing the doses right for your kid if you are preparing for your kid as well. Other things that you can do: over the counter steroid creams. And one really useful thing when we're thinking about antihistamine classes is there may be things that come in capsules versus tabs. The cool thing about capsules is when you are compounding an additional cream, let's say you have a steroid cream that's over the counter, you can undo the capsule for the antihistamine, rub it with the ointment, and then you have an antihistamine steroid. That's a trick that I learned from Dr. Ben Abo, who's an awesome wilderness doctor and medical director of Venom Team in Florida. So he deals with a lot of different bites, and the team doctor for Kings of Pain on the History Channel. So he knows his stuff. And that was one nice trick that I learned from him that I really, really like and use often. So allergic reactions and skin infections. If you haven't viewed our last video on skin infections. We talk about the signs and symptoms of skin infections and when to know when you need antibiotics and how to clean it too. So, if you remember anything from that video, let me know how you identify infection. How would you in the field kind of mark it so that you know it's getting better or worse? And what would you do for it? So, let me know in the comments if you're paying attention to the last video. And if you haven't, I'll put the link up somewhere here or at the end of the video. So infections are super important. And one thing that I didn't touch base on from the last video is there's a difference between skin infections, like superficial skin infections, so really close to the top, deeper infections that may be cellulitis, deeper infections that may be the fascia or the layer on top of muscles. So think about, that chicken layer that you kind of peel off. That's really gross. That's not the skin. That's fascia. So that can get infected too. But the two most common is skin infections, cellulitis, and then also abscesses. And the reason why that distinction is super important is because when you're thinking about treating things in the field, abscesses can be incredibly painful. Sometimes, like people can't sit, people can't think because it's so painful and it gets big very fast. It's like an infected bulb inside your skin, and you may poke on it, it'll be very tender, might be red, and it might feel like a little bit mushy. And sometimes it can be an infected hair follicle or becoming an infected cyst. And those ones feel a little bit rubbery, kind of like the tip of your nose almost. And the treatment for that, if there's no redness, no skin infection around it, is you stab it. So typically in the ER, what I do is I numb it up and then I poke a hole in it, and I don't even give you antibiotics. I flush it out, make sure all that gunky stuff on the inside's out, and your body heals just fine, especially if there's no infection on top. So you don't need antibiotics for that one. That's why that point was so important. So with that, when you're identifying these different things, the next thing to think about is, okay, we identified it might be an allergic reaction, it might be a skin infection. There are certain things that might tell you or give you clues that different bug bites are happening from different types of things. So, to give you an example, where do scabies typically eat? They like the fingers, they like the web space, and it's almost like a breakfast, lunch, and dinner type of pattern that goes up your arm. So that's really, really common. Also in the hair, mites, that type of thing. Mosquito, black flies, horse flies, you can see those bugs just like rip things off of your skin. So if that's interesting to you enough to warrant another video that you want me to do, let me know in the comments, because like 99% of our videos that we produce for you, in addition to our Q&A sessions, are from our followers and students. So let me know what you want to learn. And if you ever want to learn beyond that first aid, beyond the boo-boos, think about trying our courses, which we deal with life-threatening things and long-term survival, long-term, more complex medical skills and knowledge. So beyond that, the thing that I want you to kind of realize is there is identification of the bug itself. Now, I think we have some pictures over here. Let's see if we got some pictures of bugs that are relevant. So this is, let's see. Can we go completely blank? I'm not sure if it'll show you. So let's see if I can share a screen, and then we can kind of talk about some of those images, because those are really, really important images. All right, here we go. So can everyone see that? Just give me a yes or no. So this is a little bit blurry, but the thing that I want you to kind of take note of the adult female, adult male, these are deer ticks, Ixodes scapularis. So these are the ones that transmit Lyme disease for the most part. And with that, you they're quite small, and even like you can notice a picture on the top right corner. That's like I think that's a penny or maybe a dime, and these guys are quite small. So in the larvae state or in the nymph state, they might be so small you can't really tell if they have that little redness along the bottom over there. So that's what that looks like. And there are other ticks that are relevant, like deer ticks and so forth. We have maps over here, the Lyme disease. So check out if you're in the States, we see a lot of distribution in the Midwest, also in Northeast, so New England area. Look at Maine; it's just like covered and smothered with these cases of Lyme disease, and then just along the coast. So you see a little bit of spattering down to Florida, but you also see the West Coast having some issues, and then some spots in the middle of the country as well. So that's why it's important to kind of figure out where your demographic is. So, all right. So identification of the tick itself. And if you can't identify it, the one thing that I want you to focus on, if you're not sure what it looks like, is the next thing, which is you got to take it out. So one of the things we're going to be talking about is next is prevention. So if that's cool, give me a yes because we're going to go through several different things that you can use, not only if you're a camper, but also if you're a homesteader, if you're just having a backyard that is up against some woods. So if that's interesting to you, let me know and we can go into crazy, crazy details on each individual thing. So put in the comments if anything sparks your interest or if you want details because I'm going to categorize a few things. So for prevention, you're preventing ticks and a lot of different bugs. Number one, like if it's your yard and you're just wanting to protect your family, your kids, your dogs, your cats, or so for my cat goes outdoors too. So what we do is we spray our yard. So there are things that you can get commercially on Amazon and so forth. But we have a company that does that. Another thing that you can do, and this is something that one of my buddies who's also an ER doctor up in Maine, does is he has these little tubey things. So this is permethrin, and permethrin, for the most part, are things that is a chemical that really, really is useful. And I'll tell you a few different ways that you can use it. But this is basically a wax toilet paper roll with cotton balls in it, and it's soaked with a decent concentration. Let's see, 7.4% of permethrin. And I'll put the link to this in the descriptions as well. And permethrin, what it does is it is almost like a neurologic agent to ticks. And once it touches it, it kind of like paralyzes it and it can't do its damage. So, what those little tubies do is most ticks have a cycle between rodents and other animals. And then we're kind of like an innocent bystander that gets affected. So, if you're able to stop that cycle, via let's say field mice because I have a ton of field mice in my yard, squirrels, chipmunks, that type of thing. They're able to take that into their nests and burrows, and then the ticks kind of go onto them, and then they die, and then they break that cycle. So spraying your yard and also using that is a good strategy. But another thing, if you're let's say a camper or something like that, and we use this in the military too. That's why I'm so heavy on this, and this is why I buy it myself is this is permethrin, just a big jug of it. And I'll also put the link in the description as well. But you have to note that the concentration is less for your own kind of safety. So you don't want it to be caustic or damaging to your own system. So this one compared to the 7.4 and the other one, that's like for the mouse and rodents and everything like that. This one goes on your clothes. And this one is 0.5%. So a lot less potent. And what you do is you spray all your stuff that you want. And it's typically outer clothing. So no base layers, nothing that goes in your face or in sensitive areas, no underwear, please. Um, and you wash it. And when you wash it, it kind of like you have to let it dry, follow the instructions, let it dry, wash it in the washing machine. And it's good for multiple washes. So that's what they do in the military. And it's literally good for like 3 or 4 months. And then we get to treat it again, or we're supposed to treat it again. And I don't remember specifically ever getting mine retreated, but you're supposed to. So that is one way to do it. For mosquitoes and other bugs, DEET works well. I know people who like citronella, like cedar oils, tea tree oils, those types of things. When we think about like operations in jungles and that type of thing, um, I would wager money against anyone who thinks that would work as well as DEET. So yes, citronella and all these other things work to a certain degree. You'll still get bit, maybe not as much. But if you're in an area that has a very, very intense infection that's related to mosquitoes, I would consider using lots of DEET at a high concentration, and also using like long sleeves, and especially in the early mornings and also in the evenings. But another thing that I didn't really figure out until I was out of the military was a lot of bugs, especially like horseflies and that type of thing, they love attacking the back of animals and including humans. So one of the things that you can do is some caps. They come with like these little flappy things that look really goofy. I think actually Goofy had a hat like that, and you can wear even those bush boonies that a lot of military people wear. There's connections that go on the back of it that kind of drapes the neck, and if that's covered, you get a lot less bug bites as well. So being covered is super, super important. And when I'm going up to Alaska, what I'm going to be using is a combination of that boonie hat, long sleeves that are lightweight, easy breathable, and I'm using my old camouflage net because it's a net that's reduces the amount of mosquitoes that's around and inside my body, and it's actually super useful. So if you haven't seen people use a cam net for, try it out. Might be worthwhile to put in your kit because I'm using it for mosquitoes. I'm using it for an improvised chair, an improvised stretcher, an improvised hammock, and what have you. So there's multi different functionals in there because it is a really strong material. And if you need to be camouflaged, take your hunting shot, which we're going to be hunting caribou in Alaska. So be it. So, besides that, another tip that is really, really nice is duct tape. So you can do duct tape, sticky side on the outside, wrap it around your ankles. Make sure that there's no kind of spacing between where your pants go inside your boot, and where bugs can like crawl in. So you do it around that space. You can go up the lower leg as well. Can make your leg a little sweaty, but you'll notice that the ticks will climb up there and get stuck, which is nice. But again, if there's long grass and it gets you at the waist or something like that, you're still susceptible. So that's why permethrin your outer layers, super, super helpful. And I'm going to be permethering my camouflage net as well. And just to give you an idea, the netting is about like that. Like I would say like a third of a centimeter or a fourth of a centimeter wide. So they're pretty small holes. Another thing that you can do that the military does really well in their equipment, and I haven't seen a whole lot of people who have manufactured this, but it's something that you can very easily do with like a few cents of material. And like few cents is like realistic. You can go to the thrift store, buy like a nylon or a synthetic base pillowcase, and basically on the inside of your pants on the bottom, just sew a tube of material. So it's basically like a literal tube of material. Sew it on the inside of your pant leg, maybe about 3 or 4 inches up your pant leg. And what that does is you can put that tube inside your boot, so nothing can kind of go in. And then your other regular pants, if it has like a waist around it, you can put that over your boot. So you have like two ways to prevent bugs from going inside. So the military incorporate that into their pants. So in addition to that, one of the most important things, if you don't remember anything, one of the things that I really hope that you remember is to do checks. So this is one thing that you can do if you don't have antibiotics, if you don't have support. The best thing that you can do is to remove ticks as soon as you can. So every single day, you, and hopefully if you're traveling with someone, can do a buddy check from head to toe. So you're going through your hair, you're separating everything, you're going down the neck, and do this before the sun goes down. So set up your camping situation and do a head to toe examination, because why that's important. Your ability to reduce the likelihood that you go to the hospital for severe illness and go to the ICU for severe illness. Your likelihood of dying from that illness is really dependent on how long that tick is latched on. So ideally, every single day, you would be under the time it takes for the tick to transmit a lot of these diseases. So the kind of criteria for treatment, if we're giving antibiotics, is if it's been over 36 hours kind of latched on. So if it's under, you don't necessarily need the antibiotics. So that's why if you're able to do it every 24 hours in that spot and you know yesterday you looked there and it wasn't there, then you're good to go. You pull it out and your likelihood of infection or Lyme infection is quite low. So you just do regular wound care there. And the way you do it, and let me know how you take out your ticks because there are some myths out there related to removing ticks. I always carry tweezers with me, good tweezers that are able to take out splinters, to take out ticks. And you want to be getting as close to the base as possible. And once you get to that base, you are getting it and pulling straight up. You don't want to be rocking around, twisting it, or anything like that. Because what happens is you break out that mouth, and basically all its mouth and mouth guts spew onto it. And that's where a lot of the bacteria lives. Another thing that you can do, I have a survival card here from Grim Survival. This is my card. So this is something that you can get. It isn't expensive. It has a few nifty things on it. So it has a knife on it, a scalpel, a thing for that pokey type of incisions. So I personally modify my Leatherman Surge, and I know some of you have been requesting those videos. So if you're interested in how I modified my tool, let me know and I'll make that separate video for you. This survival card also has a lot of fishing hooks on it. So my buddy from Bear Essentials, who's an awesome, awesome fisherman, recommended a few different types of hooks. And these hooks are gauge hooks. There's some octopus hooks and circular hooks and some lures as well. But the main thing that I like that I use probably most often from that whole card is this little comb. So this little comb has this V notch in it, and you can that V notch is super, super useful for removing ticks because you basically go where that mouth is and you're just lifting up and it just pops right off. Super easy, super clean. And the other comb is not just for my hair, you know, it's also for burrs. So there's little differences in gauges on this so that if you're doing desert survival type of stuff and you don't want to prick your finger trying to take out the burrs out, you just pop this in and flick it off. And on the bottom part of it, it is a little bit of a saw, so you can do multiple things on it. So if you don't have that, one of the things that people have are similar kind of tick removal things that are super lightweight, kind of looks like a guitar pick. It's on Amazon. It's probably like $1. So super lightweight, not expensive, and you can get it for like $1. Um, Another thing I want to make clear that no one does this because if you do this, or if you thought about doing this, or if you heard someone tell you do this, please do not. So if you're putting like tea tree oil, if you're putting like Vaseline on that, it does allow that tick to release, but you do run the risk of it puking out its stuff into that wound. So not the best idea. I would much rather you take it up mechanically than make it puke out all its stuff that could potentially infect you. So checks and removal super important. And another thing, if you're just like a day hiker, which is awesome, my wife, who's a city person, loves that aspect of you get in and then at the end you get like a nice wine, dinner, and then a view. So the important thing to note for washing coming home from like an expedition like that, or if you're just doing like an afternoon thing, ticks do not like hot water. So hot and soapy is a good thing to go for. And then all your clothes immediately into the washer, hot, especially if you're in an area that has a lot of ticks, hot water, hot soap, and then in the dryer on high. And that would kill and take away a lot of different ticks and bugs. So if you do cold water, and it's still in there and it's still alive and you hand dry it and it's going on you the next time you put on your clothes. Not the best situation. All right. So we talked a little bit about the framework where you need to be aware of things in your area, the likelihood of getting Lyme disease in that area. We talked about some identifications of different types of bugs, and identifying some consequences is what we're going to be talking about next. Because we talked a little bit about allergic stuff, we talked about infection stuff, but why did our students request tick-borne illnesses? Why was that such a crazy thing to think of? Actually, it's not a crazy thing to think of. It is a very smart thing to think of because I'm sure you've heard of or you've read about people who get really, really bad diseases. We're talking about paralysis, your face looking all wonky when one side is paralyzed and almost looks like you have a stroke, people having heart issues, people having brain issues, brain infections, and ending up being in the ICU. That is in the realm of possibility when we're thinking about tick-borne illnesses. So, what should we know about tick-borne illnesses? One of the things that I'm going to share with you right now is a rash that you should probably ingrain into your memory. So, I'm going to find it over here. Let's see if we have it out. Yes, we do. Awesome. So, let me share this. All right. So, this is the classic target lesion, typically seen with Lyme disease or early Lyme disease. So, if you don't remove that tick out within that first 24 to 36 hours, and you're thinking, no big deal. And this happens. This is your one shot to make sure you don't end up with long term issues because there are two doses of antibiotics. The first antibiotic is okay, you've gone it off within just over 36 hours. You've have no symptoms. The bug bite was taken care of, and you get one dose of an antibiotic called doxycycline. For adults, it's 200 milligrams once. But if you say like, "Oh, I took it off. I'm not sure how long it's been on me. I've been camping," and then you get this rash. This is typically starting with a little bit of redness, and then what happens is there's a area of clearness. Then afterwards, there's an area of redness again. So that's your classic targetoid lesion and or skin rash. And there's about like a good chance that a lot of people with Lyme disease or getting Lyme disease gets this. I think it's on the scale of like 80%. Now there are versions of this. If you look at the bottom one, because so those are like two different versions, the top right and the left one. The bottom right shows these blistering lesions. So that's a possibility as well. So if it blisters, don't think it's not possible Lyme, because if this is the case, what you would likely need is antibiotics for longer amounts of time. So we're talking about like 5 days to 10 days. And depending on what kind of tick illness this is, so if you are still having symptoms, some physicians often prefer that you're, let's say, not having fevers and other issues for at least 3 days. We have a question here from one of our students. Is it worth sending removed ticks to tick labs for screenings? Many universities, as well as military, offer this. You can do it for your own curiosity, but if you are removing it within 36 hours, so you're at the 36-hour mark or soon after that, you can get that first dose of antibiotics, or even if you are, let's say, beyond 36 hours, you didn't notice it was on you, it was like in the back of your head in a weird position, and you've gone this new rash, this it's called erythema migrans, or the targetoid lesion. If even if you get that and you're sending in the tick, it takes some time to come back. So by the time it comes back, you would have kind of completed your course of antibiotics. So you can do it for your own curiosity. But what I would do after those first few days, taking the antibiotics, seeing the rash go down, is to see your family doc, because if you're having any other symptoms, it may be worthwhile to get those additional blood tests so we can see, based on your blood, what has infected you. So there's like Lyme disease, there's all these different other tick-borne illnesses, and we test pretty much all of them. And there can be issues with other things outside of a skin rash. So we talked about it a little bit. I want you to check out this table because it is pretty useful. So check this out. Let me make this big, big, big. So when we think about the different types of ticks, like let's say if you're in the Rocky Mountain spotted fever area, there are skin signs. So right here, skin signs. Maculopapular. What does that mean? Maculopapular means that it's flat, red, but papular means that it has a little bump on it as well. So it's red, can have a little bump on it as well. And this one of the things that you want to look out for, let's say you don't know what kind of tick it was, you know that you're in a tick area, and you get a weird rash. It can be any type of rash because typically it just starts as like a little red thing. So that can be similar to what starts as a what you think is a mosquito bite. But one thing that happens that's different is this bruising type little rash. And I'll show a picture for you guys right after this. But it typically happens on the hands, palms, and soles. So Rocky Mountain, think about like someone trying to climb rock climb. And if you get a rash 2 to 3 days after that, watch out because in addition to this, what happens is you can get issues with your basically your platelets. So that's thrombocytopenia, low platelets. So you can have a high likelihood of bleeding multiple different places, and have what is really concerning, um, hyponatremia and other issues with your inflammatory system. So if you look at the fatality rate for Rocky Mountain spotted fever, 5 to 10%. Everything else is like way less than that. So that's a good one to keep an eye on. Rocky Mountain spotted fever. When we think about other things, so Rocky Mountain spotted fever, for those of you who are from Arkansas, from Missouri, North Carolina, Oklahoma, Tennessee, or even Arizona, this is your thing. This is one of the things that could be affecting you. So if you're from that area, let me know in the comments. Another thing, another different type of tick-borne illness. So this can get pretty complicated, but if you notice, like you got some kind of bite and you have a rash, that's your cue to go see a doctor. So another one is anaplasmosis, and this is a disease that one of our students wanted to know more about. So anaplasmosis. So it's the last one here, and anaplasmosis. Think about you're having a lot of cold-like symptoms. You might have a fever, a headache. You might think it's COVID or the flu or something else, but you were just in the bush. You know, it's been about 5 to 14 days when some of this stuff is happening. And this is for our New England people, our Midwest people. Um, and you really might think this is the flu because you get the same shaking chills. But the thing that this one does, similar to the Rocky Mountain spotted fever, so you'll get the low platelets, the easy bruising. You don't get the rash though. What you get instead is a lot of immune kind of depression from this. And with that immune depression with this, you can have opportunistic other infections like fungus infections and viral infections. So you can be predisposed to that and predisposed to these minor bleeding issues. Now, the third one that I want to talk about is these categories. So I can't even attempt to to pronounce that. If you guys can make a phonetic pronunciation of that, then that's awesome. But I'm gonna pronounce it as whew, Ehrlichia, Ehrlichia. And the one thing that can happen over here, again, we can have some laboratory findings that you won't discover when you're out there, but you might feel like really weak, and you might have a rash. But again, this is not as prevalent as your Rocky Mountain spotted fever rash or your Lyme disease rash. But this one, this class has stomach issues. So you might have some cramps as well. So if you're thinking about, hey, I got a tick bite, I may not have a rash, but I'm getting all these weird changes in how I'm feeling. I feel kind of sick. My stomach's really cramping. That's also your sign to go see your doctor. All right. So we talked about a few different tick stuff, and I know a lot of you are waiting towards the end because what is the use of learning all this if you don't know how to treat it? So there are things before we treat it that you need to look out for. We talked about the rashes, we talked about fevers, muscle cramps, any numbness and tingling. For those of you who've, like myself, as a kid in the military, did not know any of this stuff even existed, wasn't even sure if Lyme disease was a real thing, have gotten ticks on, didn't know how long it was stuck on, and removed it at my own leisure. And months go by, the years go by, and you might have some numbness, some palpitations. Like I literally have some heart palpitations, and I think it's from something else. I'll see if you guys can figure it out. I snore. See if you can make that connection. If you do, I'll be super, super impressed. So let me know what you think caused this right bundle branch block or impartial. It's a partial, incomplete right bundle branch block. That's a tongue twister. So I've had palpitations before, facial asymmetry we talked about. So if you're having some of those things, those are like some pretty extensive Lyme things. And sometimes it'll hit you weeks after. And if that's the case, like you need to get your butt to the ER. It's not a time to be like, I don't want to tough it out because you need IV antibiotics actually for that. So treatment, 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 treatment. So we talked about the first line of treatment is removing as soon as possible, doing those checks and part of prevention and treatment. And really, when we think about treating these as wounds, you can do things like clean the wounds. You can do things like topical antibiotics to prevent skin infections. But for these actual infections that have anaplasmosis, that have Lyme disease, that have that one that starts with an E that I can't pronounce, you need antibiotics. And a lot of you out there, I know you guys want a home remedy or some kind of herb that you can use. And for wound care, there's definitely options out there. Let me know what natural options you remember or you've heard of to prevent infections because there's a lot of options out there. But specifically for Lyme disease and a lot of these tick-borne illnesses, get your butt to the ER to get some antibiotics. And if you don't, power to you because I'm going to tell you about something that you can do. And I'll put it in the descriptions as well. As soon as I get my link to do it, there are companies out there that can give you antibiotics. So there are awesome ER doctors, two different companies that I recommend, and they give you antibiotics. They have a telemedicine visit. So if you're going to the middle of nowhere in whatever country, they'll look at whatever diseases are prevalent there and they'll be able to give you antibiotics. So I have doxycycline in my cupboard because of that company. I have cephalexin, I have augmentin, I have Flagyl, I have all these different antibiotics that I've personally used because I'm number one, able to diagnose it myself. And number two, if I'm going on a trip like Alaska and I got the tick off and it's been more than that 36 hours and I'm scared of getting Lyme disease, I can treat myself out there with just one dose. I don't even have to use the whole prescription. So there are ways for you to do that as well. So that is a lot of what we talked about. And yeah, I hope that was helpful for you guys. We do this every single week, and I'm trying to provide as much value as possible. This is just the tip of the iceberg because we're just talking about first aid. So if you want to learn how to save a life, check out our free 30-day trial of all of this. So we talked about first aid stuff, we talk about survival stuff, we talk about life-saving stuff, and you get to peruse our community, you get to try our lessons, and you get to talk to me directly for 30 days. And if you like it, it's not that expensive moving forward. So I'll put that link in the description as well. And we are going to do some questions because there are quite a lot. Let's see. Ooh, 70. Thank you guys for engaging. So let's see. Oh yeah. So the generated AI of the video. I was trying to find a picture of a tick, but I can definitely upload one. No problem. Mm. So if you if you have a diet where you are eating things that are often integrated with that cycle of tick infection and then back to you, yes, that is something that you can do. But does it give you an immune system? Is it like an oral vaccine? I haven't seen research about it, but it's something that I'll look up for you. So I will respond to that question once I see um, some more information. So we have people who live in Connecticut, never had Lyme, uses a lot of precaution. Yeah, prevention's key. Prevention and early removal is super, super important. Ooh, mugwort. That is one that I haven't used personally. We have some questions over here. Am I Vietnamese? No, I am mostly Chinese. My dad's from the Philippines, but I am very much mostly Chinese. Tick bite almost killed me. I get antibiotics going at first sign of bad, but yeah. So again, if it's within that 36 hours, the likelihood of transmission is really low. But if you're scared about that transmission, and if you're in an area that has a bunch of tick-borne illnesses, that one-time dose, even for pregnant women and even for children, are recommended. Because when we think about doxycycline, there has been some concerns about like the tetracycline classes of antibiotics giving bone changes and colorations and teeth change colorations. But one dose right now is not something, or even a short course of antibiotics is not something that is contraindicated and not allowed in that demographic of pregnant people and in children. So yes, get antibiotics when you can. Yikes. Yeah, my wife's family's from Michigan. I went to Michigan State, so yeah. Yeah, we got people in the Ozarks. Yeah, they are getting just bit apart by ticks. Ouch. So again, make sure you have a way to remove these things, and a good set of tweezers is something that I always carry in my first aid kit. We got some people from Alberta, Ohio. Right on, right on, right on. Central Minnesota. Sweet. Ooh, this is kind of my worst nightmare because if you get bit by, or like if you eat something that has this disease specifically for deer, you can be allergic to red meat, which is super, super scary because I'm trying to hunt more. West Nile virus, yep, definitely something that you should look out for, especially traveling. That's why long sleeves is a good idea, especially at dawn and dusk. DEET and cover, cover, cover. Thank you guys for all these engagements. This is awesome. I recognize you. Welcome to one of our new students who's coming here from Canadian Prepper. We did a lot of awesome segments over there. So if you haven't checked out his channel, he is basically everything preparedness. And if you're thinking about what's going on with Russia or Ukraine and World War III, like he gets updates from all over the place, and he's just on his stuff with that. So it's almost like a news channel over there. Yes. So you can use permethrin to treat your animals. So this big guy over here, there was a picture on dogs, which I would prefer using a dedicated things for your dogs, but I've seen people use it on their farm animals. Yeah, for sure. Ooh, caffeine in the insect spray, that nicotine at work. Another nice one, my buddy from Bare Essentials, what he did a video about a lemon that you turn inside out and keep the stem as like a little wick on the inside. You just put some olive oil over there, and it's almost like a citronella type of scent that keeps some of the bugs away. But you will get bit. You will get bit a little bit. Ooh, so some of our here. Let me. Where was it? Let me take this off because we have some student questions over here. Okay. Awesome question by Michael. Can I use amoxicillin in the place of doxycycline for ticks? Amoxicillin is definitely easier to get than doxycycline, but the answer is no. It's not as effective at all. So sometimes, and this is, I think, the last recommendation I looked at was from CDC, and this was, I think, published in 2024. So it's like pretty darn recent. And they're saying if you can't take doxycycline, sometimes like they don't give you an alternative. Azithromycin, again, no. Yeah, and there are different types of organizations. Will they cost a bunch of money? Yes. So different types of antibiotics, like I would say around like 200, and you get like a bunch of different ones. But is it something that I would recommend? Especially some one of these companies that I'm going to describe in the descriptions also has chronic medications. So if you have like heart failure, if you have diabetes or so forth, and you have your prescription from your doctor, they'll fill like 6 months for you. So you get to stockpile that if you're like out in the bush. So especially for those of you who live quite far away from your family doctor, I have some patients who drive like an hour or 2 hours to just to come to the ER. That might be a good option for you. Yeah. So Michael is one of our star students. He's a former medical practitioner in the military, and every single time he comes up with amazing resources. I'm so appreciative for him to be part of our community. He was saying that his local doc recommends a CDC Yellow Book reference to prescribe travel medications. So yeah, that's awesome because some family docs, they if you go to them, say like, "Hey, I'm going to this country, and this is what's recommended in this yellow book," that might save you a visit because sometimes travel medicine docs aren't covered by your insurance. And if you're concerned about paying some companies for the antibiotics, that visit might be as expensive, if not more, and you might not get as many things. So, what's the best way to get prescriptions if you're traveling and going to the field doc? To this date, like those two companies are the companies that I'm aware of. If I find a better way to do it, or if I get enough support from you guys and I get licensed across wherever, um, and I can prescribe medications for you, and I know we're going on an expedition and we can that can be part of your package, like let me know if that's something that you would want to do. Come on an expedition with me in the middle of nowhere. You have an expedition doctor with you, and as part of your bonuses, you'll get your trauma kit and you'll get like a buttload of medications that are prescription medications. So if that's interesting to you, and if that's something that you want to do, and you get to take that home with you, and it will literally last you quite some time, say yes to that. Let me know in the comments. Ooh, okay. Michael, you are stimulating the neurons over here. Michael says, I think your right bundle branch block may be a result of pulmonary embolism, maybe resulting from HAPE. What is HAPE? So, HAPE is high altitude pulmonary edema. And that is like, this is high level stuff. So, you guys are getting stuff that a lot of what me and my students will be talking about privately. But yes, the idea is that your heart and your lungs are kind of in sequence. If one is messed up, the other suffers. So typically, you receive blood from everywhere in your body to the right side of your heart. There's four chambers in your heart. So the right side has a top and bottom, and your left side has a top and bottom. So the top receives it, then goes out to the bottom chamber, sends it to the lungs, and then it receives it through the top chamber in the left, and then it goes to the second chamber on the left, the bottom chamber, and then sends it out to your body. So what happens if your body receives the blood from everywhere into that right side, and then as it's going to the lungs, there's either a blockage, which would be very, very bad if it was acute. So Michael was talking about a pulmonary embolism. So that's a clot in your lungs. That'd be very, very bad. But let's say it's over time. The hint that I gave you was I snore. So if you are, let's say, Asian, because that's actually a risk factor. If you are slightly overweight, if you have a thick neck, or if you're have a meaty neck because you work out and you weight lift and all that stuff, if you have a big neck and you snore a bunch and you wake up, you're kind of groggy, rest doesn't seem very very restful, and you often wake up with headaches. It's your time. It's your time to get evaluated by a sleep doctor. I'm waiting for my family doctor's visit so I can get a referral. But it's your time to get a sleep doctor referral, because what does sleep apnea, which is what it is, do to your lungs? It makes it harder for your heart to push stuff. It gets damaged, it gets fibrosed, and over time your heart gets bigger and bigger and bigger, and that could potentially give you issues like conduction issues, like I might have. That's my suspicion. That's my running suspicion, because I have had that for quite some time now. And Asians typically get it because of their anatomy up here, so it's not necessarily down here. It's up here. Can I link my card in the descriptions? You sure bet I can. So I'll find that, because one thing that you can do is go to www.survivaldoctors.com/store, and that's basically my affiliate store. So I think my Grim Survival card is there, and I get a few cents for that. So if you guys need anything or want to upgrade your stuff, please click the links in the description, because that just helps me out so that I can pay an editor. Right now, I'm editing most of my stuff, and I can support our students and support you guys with some awesome information, because this type of stuff, like, this is more information than you would get at your doctor's visit, for sure, for sure. Because is your doctor going to spend 40 minutes with you or an hour with you talking about a topic? No, no, they're going to spend like 5, maybe 15 minutes if you have a really good doctor, or 45 if you do concierge or apply to some concierge medicine. Mikey, what's up, man? Yeah, buddy. We got you covered. You ask, we deliver. Wes is my cousin. Shout out. Big inspiration for me getting smarter. Yeah, deer ticks. So deer ticks, those are the Ixodes scapularis that carry limes. Yeah. What antibiotics do people get that are allergic to penicillin? So, awesome question. And when we're talking about allergies to penicillin, you got to think about different classes. So, if you are having your throat swell up, you have facial swelling, your tongue feels weird, do not take penicillin. But if your doctor told you that, like, as a kid you had maybe a skin reaction and it was over 10 years ago, the likelihood of you having a penicillin reaction is a lot less after that amount of time, especially if it was very mild. So it would be worthwhile to get allergy testing. That's probably one of the best things that you can do because it kind of closes the door for a lot of different antibiotics if you're allergic to penicillin. But let's say if you have skin infections, there's a ton of different options. Like you can use doxycycline for instead of penicillin. You can use Bactrim. You can also use clindamycin is another good one. And even if the chemical structures are somewhat similar, so I would not use cephalexin, so Keflex, but you can use things in the Keflex kind of category, the family of drug, but in a higher generation because the molecular structure is a little different. So if you have a penicillin allergy and it's not severe, and you have a pneumonia or you have a very severe UTI, I can give you ceftriaxone, which is in the same drug class as Keflex. Being single, how can you check yourself um, with with ticks basically? So very systematically, you're basically going from head to toe. You're feeling any little nubs. It might be some dirt, so try to like bring a comb. Like that's one thing that you can bring, like just that little plastic cheap things that you can get in the dollar store. Like comb your hair, make sure that the grit's out there, and you don't feel any new lumps. I'm literally checking myself right now because I live in tick country too. And with that, just go down in sections and have a mirror. So I always carry a compass, and in that compass, I have a signaling mirror in it. So I'm literally looking down, looking at my junk to make sure that I'm not missing anything in those sensitive areas. Minnesota, welcome, welcome. Eugene, Oregon. I love that you guys are coming from all over the place because depending on where you're coming from, again, tick-borne illness, your location, see what's out there because it's might not be the Lyme targetoid lesions. You might get something else. One thing that I wanted to show you before you guys step off. Let's see if we can do this. So the Rocky Mountain spotted fever. So if you get fevers, yeah, so hands and feet, remember when we talked about Rocky Mountain spotted fevers, kind of like the rock climber type of distribution. These are actually ruptured, kind of like little blood blister type of things. So maculopapular, so basically like kind of bruises type of deal. And the reason why that's happening is again that thrombocytopenia, that low platelets. When you have low platelets, things tend to bleed spontaneously, and that's what happens here. And things can get systemic real fast. So rash, outdoor exposure, tick area, go see your doctor or have antibiotics on board. Quick fix. Ah, no, your dogs. Got some dogs that got some tick-borne illnesses. That's a shame. Ooh, look at this, smarty pants. Richard, do you have sleep apnea? Yes, I think I do. I probably do. For those of you who are just like me, who are waiting forever to see a family doctor so they can get a referral to do a sleep study, which will take probably another 3 to 6 months to get that diagnosis. You can get a dental device. It's probably like anywhere from $20 to $30, and it just pushes your lower jaw forward. So what that does is it keeps your tongue out of the way and you snort less. Chapstick for people who do that because your lips do get really dry. Okay. Reading them at the end. Reading them at the end. That's awesome that your doctor does that. So it saves you a trip because some people just like wait forever to see their doctor. Okay. Whoever is having access to Google right now, let me know in the comments what is the tick-borne illness that leaves you allergic to red meat? Because I forgot off the top of my head, but it's a really quick Google search because it is real. It is real. All right. So I'm allergic to mosquito bites. What can I do to alleviate some of the symptoms? So we talked about Benadryl, we talked about cetirizine, which is Claritin, and typically get it done earlier. So if you have known allergic reactions to it, you can do some topical steroids again with a little bit of antihistamines sprinkled into that, and you kind of mush it around till it is all smooth and not granular, and you can put it over yourself, and that helps. Yep. When I was in the military, I snored so bad I wasn't allowed in the tent with the other guys. Ambulance sleeps. Nice. Portugal. Awesome. Are there any vaccination for Lyme disease? I don't think it's widely available right now, especially for insurance coverage. But hopefully in the future, because I know for some animals it might be. Georgia. Awesome. Maggie, welcome. Welcome. Ooh, thank you, Maggie. So immediately, Maggie provides value for everyone over here. What are your thoughts on fish antibiotics? So, fish antibiotics is a huge topic. I know there are some docs out there, especially in the survival medicine community, who promote it. And if you have nothing, literally, if you have nothing, maybe, probably, perhaps it will work. But the issue is there is no onus, no responsibility for those companies to give you what you need to avoid any other derivatives that might be toxic to you or cause you harm. And they have no kind of responsibility to give you the correct dose. So, at the very least, pet like dog, cat, and other animal antibiotics, they're governed by a pharmacy kind of FDA type of deal. And for humans, that drug has to deliver that dose, and it has to have a certain level of quality. Fish antibiotics doesn't have anything. So, would I rate a vet for antibiotics? Sure. But would it be fish antibiotics? I'd try to avoid fish antibiotics if I could, as the last thing. And would I rather stock up on antibiotics that are prescribed for humans? Absolutely. So if you are able to do that through one of those two companies, I would much rather you do that because you would source something that's effective, that's meant for humans, that ensures you get the correct dose without any kind of weird additives. Okay, so we have a question here. Should you take doxycycline daily as a preventative thing? Um, Somewhere in Mesopotamia, uh, bites. Okay, so for this one, this is kind of outside my area of expertise. I would have to look that out specifically for that type of disease. When we think about malaria, there are medications that you can take that are preventative, like Malarone. That's what I take. It has some of the least amount of side effects. Um, so there are preventative medications that you can take in those situations, but I would have to double check if doxycycline, the antibiotic specifically, is one of them. They might be because I remember when I was going to East Africa, there was a medication that gave phototoxicity. That means you sunburn easily, and doxycycline does that. So yeah, so if your throat swells up and that's causing from an antibiotic, do not try to risk that. Minnesota, what up? Joyce, happy to see you here. Mike, avoiding ticks by sleeping in a hammock. I've had ticks climb up. So like if your legs are hanging beneath there, those buggers get in there. So still I would do tick checks. Yeah, we got some sleep apnea people. Right on. So, can you be fully immune after a tick infection? There are different tick diseases, so you probably won't be immune to everything. Do you have antibodies? Yes, you do have antibodies. So there is some reaction that your body does. Is it good enough to prevent Lyme disease in the future? Questionable. Questionable. Oh, thank you, Mikey. Alpha Gale syndrome, red meat tick-borne illness. Guys, like, yeah, look for where that is endemic in your area and be very, very mindful because it would suck if you're a deer whitetail hunter. You do that, you eat that, and then you can't eat red meat ever again. Oh, no steaks. Jerome, what's up, buddy? I'll be going to Montreal in June, actually, for a wedding. So, is there a tick-borne illness that causes a reaction that goes to the throat and swells up the throat and triggers an autoimmune disease that covers your body in small blisters? So, I haven't seen a specific tick in North America that does that. There are ticks that leave necrotic lesions. So, necrotic means like dead, blackish type of scabby things, but I haven't seen one that causes like throat swelling up. And that might be an underlying autoimmune thing where it triggered your underlying autoimmune thing. Because a lot of what that's kind of you're describing is almost like an allergic reaction to that bite or to that toxin that the bug is giving you. Nice. Awesome, guys. So if you guys want access to some of the behind the scenes stuff, think about trying out our course. Because right now I'm gonna step off and the live and talk to our students. Thanks again, guys. Thanks for the engagement. We had over 100 comments over here. So thank you, thank you, thank you. And I'll see you next time, next Thursday. Before you leave, let me know what would be interesting for you to learn on the medical side of survival and preparedness. And I'll prime us for next week. See you guys.